Namaste. Welcome you all for the yoga session. In this, we are going to look at three important postures that, when done in a continuous fashion, helps the complete osteoligamentous muscular structure. The three postures that we are going to look at are Bhujanaga, Chaturanga, Adhomukha, Svanasana. And this trio of asanas will be done at three different speeds. First, we are going to do at a faster pace, then we shall reduce the pace further, then towards the end we shall make it all the more slower. This approach helps to trigger different types of fibers that are there in the muscle that respond to faster and slower movements. We shall first begin with preliminary postures. Lie on your back, fold both the legs, heel closer to the hips, foot 6 inches apart, foot parallel to one another. Feel your breathing. As we inhale, the abdominal cavity should expand. As we exhale, it should contract. Feel also the posterior region at the lower back that also responds to the breathing. Watch your breathing. Chest should be reasonably stable, neutral. Watch the movement of the diaphragm. As we inhale, allow the abdominal cavity to expand. Stretch both arms up. Breathe consciously. Neck at the center, chin towards the chest. Raise your right leg up. Stretch the heel. Pull the kneecap. Toes towards the knee. Pull the kneecap. Tighten the quadriceps, the front of the thigh. Feel the stretch at the back of the thigh. Watch your hip. Watch the gluteal muscles or the muscles of the hip. Watch your back muscles. Press the left foot. For that you got to activate the calf muscle. Also contract the hamstring muscles against the calf muscle and feel the knee capsule. That is the outer covering of the knee on your left leg. Fold right leg down. Left leg up. Pull the kneecap. Stretch the heel. Consciously watch the muscles of the leg, especially the calf muscle, hamstring, then the muscles of the hip, and also the lower back. Do not miss out on your breathing. Down, right leg up. When raising the legs, also ensure that the base of the spine does not take off the floor. Pull the kneecap, stretch the heel, the muscles of the leg, especially the hamstring, they help the back a great deal. Right leg down, chain, left leg. Pull the kneecap, stretch the heel. So feel the stretch. Relax the left leg. Right leg up. Fold. hold the right knee from both hands and pull the knee closer to the chest. And keep the foot, knee and the hip in the same plane. That is, do not move the knee out of the plane. And on both the legs, squeeze the hamstring muscles against the calf muscle. Watch your breathing. Release right leg. Left leg up. Hold the knee, press the knee closer to the chest. This particular posture does help the gluteal minimus and the gluteal medius muscles. These are the two muscles in the region of the hip that greatly helps in all our walking. Pay attention to the breathing. That is the key. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. Release left leg. Right leg up. Fold, hold the knee, press the knee closer to the chest. Stretch the heel, right heel, that is toes towards the knee. Do not neglect the left leg. You should press the left foot. For that you have to activate the calf muscle, then contract the back of the left thigh. Watch also the posterior skin, the thick skin resting on the floor. Release right leg. Change. Left leg up. Fold. Hold the knee. Press the knee closer to the chest. The posterior thick skin on your lower back, the thoracolumbar fascia as it is called, that also responds to breathing. Just watch that. It also experiences a mild stretch as you inhale and a contraction as you exhale. Get connected with the posture. Get connected with the breathing. Be present. Release left leg. Right leg up. Fold the knee from left hand. Hold the ankle joint. Pull it closer to the root of the left thigh. From right hand, push the knee. On both the legs, contract the hamstring muscles, the back of the thigh against the calf muscle to enhance the feeling of the knee capsule. As you inhale, sensitize the base of the spine. Change. Left leg up, fold from right hand, hold the ankle joint, pull the heel closer to the root of the right thigh. From left hand, push the knee. It's very important to have complete postural awareness. Do not allow the pelvis to rotate. Release left leg. One more time. Right leg up. Fold from left hand. Hold the ankle joint. Pull the heel closer to the root of the thigh. From right hand, push the knee. Activate the back of the thigh on both the legs. Breathe consciously.
Feel the base of the spine. All these postures are designed to help the core muscles, which would include the region of the abdomen, the lower back, the hip, the pelvis. Release right leg. Chain left leg. Fold from right hand, hold the ankle joint. Pull the heel closer to the root of the thigh. From left hand, push the knee. This posture also obviously helps the knee joint, the hip socket, also gets a good soothing movement. Good breathing is the foundation for all these postures. Release left leg. Stretch your left leg forward, roll onto the right side, press the left palm, slowly get up.
Sit upright. Keep a flooded blanket. Rest the knee on the blanket. Sit in the all fours position. We are going to work with 3 postures. Now we are going to do rather fast. Watch your breathing also. All movements are with exhalation. Middle finger pointing forward. As you exhale, contract the abdominal muscles. Stretch the toes. Watch the trunk. Exhale, bend back Bhujangasana. Inhale, exhale, Chaturanga Dandasana, Bhujangasana, Adhomukha Shvanasana, arms straight, legs straight. Inhale, exhale, Bhujangasana, Chaturanga Dandasana, Bhujangasana, Adhomukha Shvanasana. All movements are with exhalation. Press the palm. Inhale, exhale, bend back Bhujangasana, Chaturanga, Bhujanga, Adhomukha. Keep the palm pressed, do not slide the palm. Bhujanga, Chaturanga, Bhujanga, Adhomukha. Watch your breathing. Bhujanga, Chaturanga. Watch the postures. Bhujanga, Adhomukha, Bhujanga, Chaturanga, Bhujanga, Adhomukha, Bhujanga, Chaturanga, Bhujanga, Adhomukha. Watch the preservation on the wrist and the palm. Bhujanga, Chaturanga, Bhujanga, Adhomukha. Watch your elbows. Bhujanga, Chaturanga, Bhujanga, Adhomukha. Watch your shoulder joints. Bhujanga, Chaturanga, Bhujanga, Adhomukha, Bhujanga. Watch your upper back. Chaturanga, Bhujanga, Adhomukha. Keep the neck reasonably relaxed. Bhujanga, Chaturanga, Bhujanga, Adhomukha. Watch your lower back and the hips. Bhujanga, Chaturanga, Bhujanga, Adhomukha, Bhujanga, Chaturanga, Bhujanga, Adhomukha, Bhujanga, Chaturanga, Bhujanga, Adhomukha. Watch your legs. Bhujanga, Chaturanga, Bhujanga, Adhomukha, Watch your foot. Bhujanga, Chaturanga, Bhujanga, Adhomukha, Bhujanga, Chaturanga, Bhujanga, Adhomukha, Bhujanga, Chaturanga, Bhujanga, Adhomukha. Press the palm. Bhujanga, Chaturanga, Bhujanga, Adhomukha. Press the foot. Bhujanga, stretch the toes. Chaturanga, foot neutral. Bhujanga, stretch the toes. Adhomukha, dorsiflexion. Bhujanga, Chaturanga, Bhujanga, Adhomukha. Bhujanga, Chaturanga, Bhujanga, Adhomukha. Do not hold the breath. Bhujanga, action and breathing should synchronize. Chaturanga, Bhujanga, Adhomukha. Bhujanga, Chaturanga, Bhujanga, Adhomukha. Bhujanga, Chaturanga, Bhujanga, Adhomukha. Bhujanga, Chaturanga, Bhujanga, Adhomukha. Breathe well. Bhujanga, Chaturanga, Bhujanga, Adhomukha. Bhujanga, Chaturanga, Bhujanga, Adhomukha. Ensure that there are no jerky movements. Bhujanga, Chaturanga, Bhujanga, Adhomukha. 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 Pay attention to the movement. Get involved. Bhujanga, Chaturanga, Bhujanga, Adhomukha. Don't do the movements mechanically. Bhujanga, Chaturanga, Bhujanga, Adhomukha. Bhujanga, Chaturanga, Bhujanga, Adhomukha. Bhujanga, Chaturanga, Bhujanga, Adhomukha. Bhujanga, Chaturanga, Bhujanga, Adhomukha. Bhujanga, Chaturanga, Bhujanga. Keep on watching the movements. Adhomukha. Get involved. Bhujanga, Chaturanga, Bhujanga, Adhomukha. 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 Do not lose the intensity of the posture. Bhujanga, Chaturanga, Bhujanga, Adhomukha. Bhujanga, Chaturanga, Bhujanga, Adhomukha. Bhujanga, Chaturanga, Bhujanga, Adhomukha, 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 Bhujanga, Chaturanga, Bhujanga, Adhomukha. Ensure that you don't slide the palm or change the palm. Bhujanga, Chaturanga, Bhujanga, Adhomukha. You should press the palm firmly. From Adhomukha, flex the knee, relax, sit on your heel. So this fast pace of movement also helps you to burn some excess fat. But in doing fast, you should not lose the definition of the posture. Relax your breathing. Watch your breathing. When you do fast, the heart rate increases, the fat metabolism also improves, and the muscle fibers that are set to give you fast movements, they become rejuvenated. We shall continue with the same series, but we shall now reduce the pace or the speed in which we have done. So reducing the speed and holding the posture also has its benefit. There are muscles which are meant to sustain a longer duration of loading, and to improve those muscle fibers, the approach of doing it slowly is further helpful. Sit in the all fours, knee below the hips, palm below the shoulders, trunk nearly parallel to the ground. Inhale, exhale, bend back, Bhujangasana. Press the palm, well open the shoulders, lift the neck up the clavicle and look up. Well open the chest. Feel the stretch in the pelvis, abdomen and the chest. Open the shoulders. Tighten the buttocks. Inhale, exhale, Chaturanga Dandasana. Flex the elbows. Watch your shoulders. Trunk and legs parallel to the ground. Foot perpendicular from the base of the toes. Press the palm. Elbows closer to the trunk. Hold the posture. Inhale, exhale, bend back. Bhujangasana. Well open the shoulders. Stretch the toes. Squeeze the calf muscles. Squeeze the buttocks. Feel the spine. Inhale, exhale, Adhomukha Svanasana. Keep the palm pressed, push the scapulae up, stretch the trunk, tighten the buttocks, feel the stretch in the hamstrings, press the foot completely. Even the heel should rest on the floor. Chin to the chest. Inhale, exhale, bend back, Bhujangasana. We'll open the shoulders. This combination of Bhujanga, Chaturanga, Bhujanga, Adhomukha is excellent, especially for the shoulder complex, elbow, wrist and the palm. They also help the back. Inhale, exhale, Chaturanga Dandasana. The back, legs, foot, they also stand to benefit. Press the palm. Chaturanga Dandasana. Only foot and the palms supporting the complete body. Inhale, exhale. Extend the elbow, Bhujangasana. Bend back. Look up. Do not hold the breath. Before you make the movement, you should completely inhale and make the movement to the next posture as you exhale. Then stay in that posture with slow, steady inhalation, exhalation. Inhale, exhale, Adhomukha Svanasana. Hips as high as possible. Then stretch the trunk, take the head towards the floor, chin towards the chest, arms straight, legs straight. Breathe well. Inhale, exhale, Bhujangasana. We'll open the chest and look up. Flex the elbow, Chaturanga Dandasana. Press the palm. Feel your shoulders, elbows. And this Chaturanga Dandasana is also good for improving the stability of the lower back. The abdominal muscles also get a better tone. Watch your cervical region also. Inhale, exhale, Bhujangasana. Extend the elbows, bend back. Chest and navel up. We'll open the shoulders. Adhomukha Svanasana. Arms straight, legs straight, hit the back of the knee, thrust the chest up, be strong on both arms, press the palm. In all these movements, fix the palms. Do not change the position of the palm. Do not slide the palm. Have a firm grip. Inhale, exhale, bend back, Bhujangasana. Open the shoulders, look up, relax your tongue, nose, throat and the jaws. You have to extend even the cervical spine. Watch the region of the throat. It also gets a good stretch. Inhale, exhale, Chaturanga Dandasana. As you exhale, contract the abdominal muscles. Bhujangasana. Stretch the toes, squeeze the calf muscle. In Bhujangasana, you can see that the foot is in plantar flexion and calf muscle is contracted. Open the shoulders. Watch the foot now in Adhomukha Svanasana. Move to Adhomukha. The calf muscles stretch and the foot, the ankle joint gets into dorsiflexion. Thus the calf muscle gets greatly activated in this sequence. In Adhomukha, it is in stretch. Bhujangasana, it contracts. Chaturanga, it is neutral. Inhale, exhale, bend back, Bhujangasana. And calf muscle is one of the very, very important muscles in the lower legs, which helps in the venous return of the blood. It is also referred to as the second heart of the body. Inhale, exhale, Chaturanga. Do not hold the breath. Inhale, exhale, bend back, Bhujangasana. Well open the shoulders. Similarly, watch the hips. Now the hips are in extension. Squeeze the buttocks. Move to Adhomukha Svanasana. Now this becomes hip flexion. Arms straight, legs straight. Chin to the chest. Inhale, exhale, bend back. From hip flexion, we are moving to hip extension. To activate the thighs and the buttocks. Move to Chaturanga. Here hip becomes almost neutral. Chest up. Only the toes and palms on the floor. Bhujangasana. Again hips get into extension. A complete lower back and upper back experiences an extension or a backward bend. Inhale, exhale, Adhomukha Svanasana. In Adhomukha Svanasana, ideally the curves of the spine do not change. However, a very slight flexion of the lumbar region can be seen. A good stretch. Adhomukha Svanasana. Keep the palm pressed. Flex the knee. Slowly come down, relax. Sit on your heel. Watch your breathing. Relax your arms, relax your legs. Vajrasana is one of the very good postures to relax the legs. Relax the arms also. Just watch your breathing. This movement not only helps the muscles, bones and ligaments, but also has a positive impact on the vital organs of our system. The organs in the pelvis, abdomen and the chest, they all gets invigorated. Now we are going to further reduce the speed. That means we are going to stay for longer duration in these postures. Sit in the all fours, Chatushpadasana, middle finger pointing forward. Note the position of the knees, knee little apart, knee below the hips, palm below the shoulders, arms straight. Relax your breathing. Inhale, exhale, bend back, Bhujangasana. We'll open the shoulders, neck up, look up. Feel the pelvis, abdomen and chest. A good stretch for the anterior portion of the trunk. The lungs and the cardiac system also experiences a good stretch. Region of the throat also gets a good stretch. Feel the pressure on the palm, middle finger pointing forward. Press the palm completely as much as possible. Trace the contact surface between the palm and the floor. Flex the elbow, move to Chaturanga Dandasana. Elbows closer to the trunk. Don't give up. Hold the posture. Do not hold the breath. Trunk and legs parallel to the ground. Here trunk is nearly neutral. Watch your breathing, but you can see the gravity. It will pull the abdominal and pelvis organs away from the spine. Experience that, feel that. As you exhale, contract the abdominal muscles. This is a very useful posture for strengthening and stabilizing the lower back and also helps the abdominal muscles. Inhale, exhale, straighten the arms, move to Bhujangasana, bend back. We'll open the chest, look up. Again develop a feel for the pelvis, abdomen and the chest, the urogenital organs, the excretory and digestive organs, lungs and the heart. They all get a good stretch. And do not hold the breath. Breathe at ease. As you inhale, abdominal cavity should expand. As you exhale, it should contract. Inhale, exhale, move to Adhomukha, Svanasana. Pump the shoulder blades up, strike the trunk down, chin towards the chest, legs straight, press the foot. Now even here, the way the gravity acts, you should see on the pelvis and the abdominal organs. So they move down towards the chest, sitting on the diaphragm. And then watch the movement of the diaphragm. It nicely massages the abdominal organs and also the cardiac muscles. The palm should not slide. You must press the palm, extend the elbows, push the shoulder blades up, stretch the trunk down, and do not hold the breath. Breathe well. Inhale, exhale, come to the all fours. Slowly bend back, Bhujangasana. We'll open the chest. Stretch the toes, squeeze the calf muscles, tighten the buttocks, bend back, press the palm, elbow straight, activate the muscles of the upper arm and forearm, open the shoulders, and look up. Extend the neck and look up. So that will also help the throat. Cervical region gets two important movements here. One is the extension as in Bhujangasana. In Chaturanga Dandasana it becomes almost neutral. Move to Chaturanga Dandasana. Flex the elbow. Watch the loading on the shoulders. The loading on the shoulders actually tightens the muscles around the neck. Feel the muscles, feel your scapular complex. Be strong on both the legs, be strong on your trunk. And of course on the arms. Bend back, Bhujangasana. Open the shoulders, look up. Bhujangasana, the neck is in extension. In Chaturanga Dandasana it is in near neutral position. These movements help them both because shoulders and necks, they are neighbors. Their health is highly interdependent. Inhale, exhale, Adhomukha Svanasana. Stretch the trunk. Now take the chin to the chest so that you also get that flexion of the neck. And shoulders also go through the alternating movement from extension in Bhujangasana to flexion in Adhomukha. Adhomukha Svanasana. Both legs straight. Press the palm, press the foot, stretch the trunk, watch your breathing, and staying longer should help you to penetrate deeper into the posture. Flex the knee, come to the all fours position. Bend back, Bhujangasana. We'll open the shoulders, move the scapulae closer, chest and navel up. Stretch the toes, tighten the calf muscle. Be aware of what you are doing. Staying longer should help the mind to penetrate deeper. All our practice should be Sthula Sukshma Sharira. It is not just the gross body taking some shape or position. The mind also should get involved. The breathing should also be done properly. Chaturanga Dandasana. Flex the elbow. Press the palm. Watch your scapulae. Watch your shoulders, elbows, wrist, palm. Watch your abdominal muscles also. The abdominal back muscles, they tighten to hold the posture. Do not hold the breathing. Chaturanga Dandasana. Watch your toes. Bend back Bhujangasana. Extend the arms, well open the chest and look up. Breathe well. This is very, very important. Proper breathing ensures better stretch and makes the practice more beneficial, more involved, and it helps to move the mind to a better meditative state. Bhujangasana. Adhomukha Svanasana. Arms straight, legs straight, straight the trunk, chin towards the chest. Breathe well. Because of the variety of required movements given to major segments of the body, this particular sequence is very interesting. In shaping our body properly. Both arms straight, both legs straight. Watch your breathing, watch the movement of the diaphragm. Watch the breath. Flex the knee. Sit upright. On your heel. Relax the shoulders. Relax your breathing. Watch your breathing. Have complete musculoskeletal awareness. All these movements specifically have a greater bearing on the shoulder complex. So relax your shoulders, upper arms, elbows, forearms. These movements are a part of the sun salutation. very, very important sequence. There's Bhujangasana, Chaturanga, Bhujanga, Adhomukha. You can sit in the all fours position. Now we are going to do the same sequence with a small variation. We are going to add a component of jump from Bhujanga to Chaturanga, Chaturanga to Bhujanga. So this involves a quick movement of the foot as we transition from Bhujanga to Chaturanga and Chaturanga to Bhujanga. Sit in the all fours. Take care of your toes. You should have a soft landing. Bhujanga. Jump Chaturanga. Jump Bhujanga. Move to Adhomukha. Bhujanga. Inner exhale, jump Chaturanga. Jump Bhujanga. Adhomukha. Bhujanga. Jump Chaturanga. Jump Adhomukha. Watch the movement of the toes. Adhomukha. Bhujanga. Jump Chaturanga. Jump Bhujanga. Adhomukha. Bhujanga. Jump Chaturanga. Jump Bhujanga. Adhomukha. Bhujanga. Jump Chaturanga. Jump Bhujanga. Jump Chaturanga. Jump Bhujanga. Chaturanga. Bhujanga. Chaturanga. Bhujanga. Jump. Chaturanga. Bhujanga. Note the jumping action. Chaturanga. Bhujanga. Chaturanga. Bhujanga. Chaturanga. Bhujanga. Chaturanga. Bhujanga. Chaturanga. Bhujanga. Adhomukha. Flex the knee. Descend. In the all fours, relax your breathing. Trunk parallel, relaxed, bend back Bhujangasana. Stretch the toes. Jump Chaturanga, jump Bhujanga, Chaturanga, Bhujanga, Chaturanga, Bhujanga, Chaturanga, Bhujanga. Watch the toes. Chaturanga, Bhujanga, Chaturanga, Bhujanga, Chaturanga, Bhujanga, Chaturanga, Bhujanga, Chaturanga, Bhujanga, Chaturanga, Bhujanga. Out to Adhomukha. Arm straight, leg straight. Flex the knee. Chatushpadasana. Just relax your breathing. In this jumping, you should note the quick change in the position of the foot from Chaturanga to Bhujanga and again from Bhujanga to Chaturanga. In Bhujanga I have to stretch the toes, in Chaturanga I have to fold the toes. Bhujanga, jump Chaturanga, Bhujanga, 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 Chaturanga, Bhujanga. Now move to Adhomukha Svanasana. Flex the knee, sit on your heel. So the jumping, you can change the speed, and these jumping actions also are of great benefit, especially to the shoulder joints and the complete scapular region and slowly lie down on your back. Keep an appropriate neck pad. Relax the breathing. Watch your breathing. First, allow the breathing to relax. Raise your right leg up. Stretch the heel, pull the kneecap. It's just to remove the strain. Right leg down, chain left leg. A gentle stretch for the leg muscles. Left leg straight. Down. Right leg up. Pull the kneecap, stretch the heel. Because of the quick movements that we have done, these preliminary postures should help to restore the muscles to normalcy. Right leg down. Chain, left leg. Breathe well. Especially relax the complete trunk and the scapular region. Left leg down. Shoulders also relaxed. Right leg up. Fold. Hold the knee. Press the knee towards the chest. Down, chain, left leg up, fold, hold the knee, press the knee towards the chest. This is good to relax the back muscles and the hip. Down. Right leg up, fold, hold the knee, press the knee towards the chest. Release right leg, chain, left leg. Left leg up, fold, hold the knee, press the knee towards the chest. Breathe at ease and feel the relaxation of the back. Release left leg. Stretch both legs. Spread the arms sideways, palm facing upwards. Drop the foot, chin towards the chest, eyes gently closed, relax your breathing, Shavasana. Just watch your breathing. Watch the incoming air and the outgoing air. Breathing should become light and shallow. Drop all your muscles and organs freely under gravity. Completely let go. But be conscious about your body, about your breathing. So in this session, you have gone through a series of movements with different speeds. When the speed is more, duration of stay is less. When the speed of movement reduces, the duration of stay increases. We have done that in 3 phases. One fast, another medium, another slow. At the end we have done some simple movements with the jumping. Thus we have covered a spectrum of possible movement patterns to help the variety of muscle fibers so that the muscles can get a better tone. And these movements also help us to gain a better neuromuscular coordination and control. They also help to strengthen the important joints. They also help the cardiac and respiratory system to become more efficient. Fold left leg, gently roll on to the right side, slowly get up. Sit upright in cross-legged posture. Namaste.